Hi everyone, let's look at the swallowing and peristalsis. Okay, the normal physiology of swallowing, the normal physiology of peristalsis. So that later on we may appreciate the pathologies associated with swallowing and peristalsis. Now, before we look at peristalsis, we should look at the swallowing reflex, because this swallowing reflex is the one that triggers esophageal motility, which is also called peristalsis. Now, there are three stages of swallowing, which is also called deglutition. There's the oral stage, when food moves from the mouth to the pharynx. There's also the pharyngeal stage, when food moves from the pharynx to the esophagus. And then there's also esophageal stage, when food moves from the esophagus to the mouth. So this one is voluntary. This one is involuntary. We have no control over these two, the pharyngeal stage and the esophageal stage. Okay. Now, we said swallowing is a reflex. So it has the components, the receptors, the afferent fibers, the efferent fibers, the centers, and the physiological response. So swallowing is a reflex response that is triggered by the afferent impulses in the trigeminal, glossopharyngeal, and the vagus. Okay. Trigeminal, it's cranial nerve number 5. Glossopharyngeal is cranial nerve number 9, and vagus nerve is cranial nerve number 10. So these are the afferent fibers involved in swallowing. Okay. The receptors, they are located in the pharynx. There's high density of receptors in the pharynx. Okay. So these impulses are integrated in the nucleus of tractus solitarius and the nucleus ambiguous. So the swallowing centers, we have the nucleus tractus solitarius and the nucleus ambiguous. Okay, somewhere here. So there's a lot of important structures within the medulla oblongata, okay, or the reticular formation. So if somebody asks you where are the swallowing centers located, they are located in the tractus solitarius and the nucleus ambiguous. When we say nucleus, it's just a group of cell bodies. Okay, a group of cell bodies. Later on, we're going to look at what really happens in the nucleus, or if it is in the peripheral nervous system, we call it ganglia. Okay, but not for now. So we've identified the afferent, the centers. Now, what about the efferent? The efferent fibers pass through to the pharyngeal musculature and the tongue via the trigeminal, the facial, and hypoglossal. Okay, trigeminal, facial, and hypoglossal. These are the ones that brings back the information to the muscles. Because for swallowing to take place, there should be muscle contraction. Okay, there are muscles of swallowing. We want to discuss those, but there should be muscle contraction. There should also be movement of the tongue, because the tongue is made up of muscles. So these are the components of the swallowing reflex. Now let's just quickly look at what really happens in the first stage of swallowing. The first stage of swallowing, as the name suggests, oral. It means the food, or it's in the mouth. So the bolus of the food is pushed by the tongue against the hard palate and then moved towards the oropharynx. Okay. The oral phase is initiated when the tongue forces a bolus of food back towards the pharynx, which contains a high density of somatosensory receptors. So activation of these receptors will initiate the involuntary swallowing reflex in the medulla. And then it will move into the second stage. The second stage, it's called the pharyngeal phase. It is involuntary. As the bolus moves into the oropharynx, the soft palate and the uvula, they close off nasopharynx. Here they have to close. We don't want the food to go into the nasal cavities. At the same time, the epiglottis, it closes over the laryngeal opening. We don't want food to enter into the trachea. This is very dangerous because it can cause obstruction of airflow, which can lead to poor ventilation perfusion mechanisms, which can eventually lead to hypoxia. Okay, so during the pharyngeal stage, there is closure of the epiglottis, there is closure of the uvula. Okay. And then we have the third stage of swallowing, which is called the esophageal stage. In the esophageal stage, as the name suggests, this is involuntary. There is peristaltic contraction of the esophageal muscles, which pushes the bolus towards the stomach. Soft palate, uvula, and larynx return to their pre-swallowing position. Okay, so during swallowing, there is stoppage of breathing just for a short period of time. Okay, there is stoppage of breathing just a short period of time. And we know that the pneumotaxic centers, that is the pontine medullary centers, they are involved in inhibition of respiration. They inhibit the dorsal respiratory groups of neurons so that respiration cannot take place. So there is stoppage of respiration during swallowing. Okay, so these are the three stages of swallowing. There's the oral phase, there's the pharyngeal phase, and the esophageal phase. Now, what about esophageal motility? Now that food is moving through the esophagus or the bolus, after the food is swallowed, the esophagus functions as a conduit to move the food from the pharynx to the stomach. So peristalsis occur. Okay. Peristalsis is a wave of contraction in the GIT. A very important wave of contraction in the GIT. Okay. And the plexus that is important in peristalsis movement is the myenteric plexus. It's very important in peristaltic movement. Now, movements of food through the esophagus, the upper esophageal sphincter opens, mediated by the swallowing reflex, allowing the bolus to move from the pharynx to the esophagus. So once the bolus enters the esophagus, the upper esophageal sphincter will close, which prevents reflux into the pharynx. And then there is primary peristaltic contraction. It's also mediated by the swallowing reflex. It involves a series of coordinated sequential contraction. Remember, in the walls of the GIT, there are pacemaker cells called the interstitial cells of Kajal. So these are able to initiate primary peristaltic movements. They are able to fire action potentials, okay, and cause local movements. As each segment of the esophagus contracts, it creates an area of high pressure just behind the bolus, pushing it down the esophagus. Each sequential contraction pushes the bolus further along. If the person is sitting or standing, this position is also accelerated by gravity. So the purpose of muscle contraction is to create a force or a pressure that will move food or the bolus towards the stomach or towards the anal region. That's the purpose of muscle contraction. Okay. So what's the mechanism of peristalsis? Peristalsis is a reflex. What is a stimulus? The stimulus is a stretch by food. When food is in the GIT, it stretches. And then we have mechanoreceptors or stretch receptors all over the GIT. They'll become activated. So when the stretch receptors become activated, there's a release of serotonin. Okay? There's a release of serotonin. There's a release of serotonin, and it appears that when serotonin has been released, it activates sensory neurons that activate the myenteric plexus. So what we are saying is that a stretch of food will cause the stretch receptors to fire an action potential, resulting into local discharge of the local neurons. At the end of the termin of the neurons, they will release serotonin, which will activate the myenteric plexus. Now, within the myenteric plexus, we have neurons that move in this direction, and then we also have neurons that move in this direction. So, neurons that moves in this direction, let's call them 1, and those that moves in this direction, okay, not really 1, we can call them retrograde neurons. This one we call them anterograde neurons. So once the myenteric plexus has been activated, the retrograde neurons, remember your food is somewhere here. Okay. The retrograde neurons will release acetylcholine and substance P. These they'll cause contraction somewhere here. They'll cause smooth muscle contraction. So there'll be high pressure here. But at the same time, these neurons that move in this direction, the anterograde neurons, they will release nitric oxide, vasointestinal peptide, and ATP. These they'll cause relaxation. So these they'll cause contraction. So when there's relaxation, it's the same as saying there's low pressure. Contraction here, it's the same as saying there's high pressure. So it will push the bolus in this direction. Okay. So this just summarizes the mechanism of peristalsis. Let me just repeat it. We are saying peristalsis is the wave of contraction. Okay, it's a wave of contraction. We can show it like this. A wave of contraction. Now this wave of contraction, what causes the muscles here to contract is because of the retrograde neurons that releases acetylcholine and substance P. They cause circular muscles to contract. At the same time, what causes these segments of the GIT to relax is because the anterograde neurons, they release vasointestinal peptide, nitric oxide, and ATP, which causes the circular muscles around that region to relax. So this happens so fast. At the end of the day, the bolus will be propagated forward. Okay. So this is what I was trying to say. Cholinergic neurons cholinergic neurons passing in the retrograde direction in this plexus will activate the neurons that releases substance P and acetylcholine, causing smooth muscle contraction. At the same time, cholinergic neurons passing in the anterograde direction activate neurons that secrete nitric oxide and vasointestinal peptide and ATP, producing relaxation at the head of the stimulus. Okay. So when food enters the stomach, the peristaltic contraction or peristaltic wave appears. It starts from the lower part of the body of the stomach and passes through the pylorus till the pyloric sphincter. It ends with a constriction of the pyloric sphincter. This type of peristaltic contraction is called digestive peristalsis because it is responsible for the grinding of food particles and mixing them with gastric juice for digestive activities. So peristaltic movement is due to muscle movements. Okay. So later on in pathologies, you're going to learn that if there's disorders in these smooth muscles of the GIT, it can affect peristaltic movement. It can affect defecation. It can affect absorption of materials. It can affect digestion. Okay. We'll discuss those. As at now, let's look at the normal, what really happens in the normal person. So in the normal person, this is the mechanism of peristalsis. So this is where I end. Thank you very much.